Have you ever been told you have a leg length difference, also called a leg length discrepancy? Or maybe you've noticed your walk feels uneven, or your shoulders look off in photos, or one hip sits higher than the other when you look in the mirror. Most people can compensate for a small leg length difference, but for about 1 in 20 people, that imbalance becomes the hidden cause of chronic low back pain, sciatica, hip issues, disc bulging or herniation, even scoliosis. Here's the kicker. If your spine is sitting on a crooked foundation caused by a leg length difference, no amount of adjustments, exercises, stretches, or massage will fix it for good. In this video, I'll show you exactly how we assess for a short leg, and I will also show you how we treat for a short leg using a method that's helped many of my patients get lasting relief after other treatments have failed. Be sure to stay right till the end, because you will also get a simple test you can easily do at home to determine if possibly a leg length difference is causing some of your spinal pain issues. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with over 25 years experience and a background in gait analysis, biomechanics, and neurology. My mission is to provide a thorough solution to spinal problems that develop from an unlevel foundation, like anatomical short legs, spinal and pelvic misalignment, poor posture, and foot dysfunction. This channel is for people dealing with chronic pain, like back pain, sciatica, neck pain, poor posture, and headaches, who are looking for real lasting relief. You'll get clear step-by-step strategies to address the root cause of these conditions so you can learn steps to take to start feeling better fast. Subscribe now for real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms so you know exactly what to do next. I upload a new video every week. Most people are surprised to learn that a short leg can be either what's called functional or anatomical. A functional short leg happens when the muscles, pelvis, or posture cause one leg to appear shorter even though both legs are the same length. It's often due to muscle tightness, a rotated pelvis, spinal misalignments, or an imbalance in how someone stands or walks. When you correct the posture or spinal alignment, that short leg disappears. For instance, if someone has a job where their pelvis is constantly tipped, like let's say someone who works in a factory or someone who works at a teller's desk, and they're leaning one way all the time, that can create a functional short leg. Misalignments in the lower spine or pelvis or in the hips can cause that as well. With spinal adjustments, stretches, exercises, oftentimes those can be completely cleared up. An anatomical short leg, on the other hand, is an actual difference in bone length between the two legs. Usually the femur, which is the long bone above the knee, or the tibia, which is the long bone below the knee. That means the structure itself is different and the body has to adapt to that difference every time you stand, walk, or move. Now here's where it becomes clinically relevant. A difference of about 5 millimeters or less is usually well tolerated by the body. Between 6 and 10 millimeters, the pelvis begins to tilt and the spine starts compensating. Once the difference reaches 10 millimeters or more, research shows that it can lead to measurable changes in spinal curvature, pelvic rotation, and uneven muscle loading, all of which increase the risk of chronic low back pain, hip pain, and even nerve irritation like sciatica. The reason this matters more than most people and even many doctors realize is because these imbalances are subtle. They often don't show up unless you specifically look for them. So people keep getting treated for muscle pain or stiffness, but the real cause is the uneven foundation that stays hidden. I've set up this little JENGA demonstration to give a visual representation of what I'm talking about. So when I said functional leg length difference, what happens there is the alignment of the spine will actually cause one of the legs to possibly pull a little bit short. Doctors of chiropractic are trained to deal with this sort of thing. We assess for it, we figure out what's causing the functional leg length difference, and we can correct the alignment of the spine. Now with anatomical leg length difference, where one leg is actually shorter than the other, like we said, what will happen there is if the difference is minimal, let's say 2, 3, 4 millimeters, which many people have a difference of, your body will be able to adapt for that generally fairly easily. So if you look at our representation, if I take these couple sheets of paper out from one side to represent a small leg length difference, you'll notice that really not much changes. Now, like we said before, once you get beyond that, once you get to 5 millimeters up to 10 millimeters or beyond, now you're going to get a significant difference. And that's represented by these little blocks I placed in. So if I was to lift and take out one of these blocks, you'll see what happens to the structure of the body. So as I gently set that down, trying not to tip the whole thing, you'll see that the body has now significantly distorted. If you have this kind of alignment, day after day, week after week, month after month, year after year, you can see how this is going to significantly affect the ankles, the knees, the hips, when one side is being overloaded. Also what happens is the muscles of the spine, the pelvis, the lower back, and the legs are going to have to work harder and out of balance just trying to correct this posture. If you're walking on a posture like this, what happens is your hip is constantly arching up on one side. So that creates all kinds of issues that can lead to things like commonly heard of as sciatica, possibly even things like scoliosis. So we're going to show you in a couple of minutes now how we assess for this and even some tests you can do to determine if this is possibly your issue. Just like the JENGA tower, your body can only compensate for so long before the imbalance starts to show up as pain or dysfunction. When you realize how small that difference can be, it's easy to see why people keep chasing pain relief without finding lasting results. So if you tried stretching, adjustments, or massage and the pain keeps returning, there's a good chance the issue isn't just what you're feeling, it's what's happening underneath. Now let's look at what's really going on when the foundation isn't corrected and why most traditional treatments can't create the lasting relief until it is. When the foundation is off, every treatment above it becomes temporary. Adjustments, massage, physio can help you feel better, but they can't hold because the spine is constantly pulled back towards imbalance. The muscles tighten again to protect the joints, the nerves stay irritated, and the same pain pattern returns. That's why addressing the underlying structural difference, the anatomical short leg, and not just the symptoms, is the key to long-term relief. So how do you know if you have a leg length difference and it's actually the reason for your pain, and what can you do about it? That's what we'll cover next. The first step in identifying and correcting for an anatomical short leg is proper assessment. In our clinic, we start with a detailed analysis of the feet, legs, pelvis, and spine. This includes a precise measurement to determine if the difference is structural, how large it is, and how much your body can compensate for naturally. The entire process takes about 15 minutes, but it gives us a clear picture of whether your foundation is level or not. If an anatomical short leg is confirmed, we then determine how much correction is needed to bring your pelvis and spine back into balance. This can be done safely and gradually using customized foot lifts, in some cases custom orthotics. Customized foot lifts come in different thicknesses. These can be added both inside and or outside your footwear. They can blend right in, no one will even know they're there, but they can make a dramatic difference. Custom orthotics we'll talk about in a later video. The results of these things can be life-changing. In our office, we have dozens of patients who've had ongoing back, hip, or even neck pain that have found lasting relief once we address their leg length difference, even after years of trying other treatments without success. It's safe, effective, and if done properly, once the foundation is level, everything above it, including your pelvis, spine, and neck, and head, can finally stay aligned. In a moment, I'm going to show you a simple at-home test that you can do yourself to check for signs of a possible leg length difference. It only takes a minute and can give you a good idea if this might be what's been holding you back your recovery. A simple at-home test that you can do to determine if a leg length difference is a problem that you may be having is to find a vertical line at your house. It can be a door frame, a corner of a wall, anything that's straight up and down. Once you have that, what you want to do is, without your shoes on, stand with your back to that line, make sure your feet are equal distant on both sides of that line, and make sure that when you stand there, you stand as relaxed as you can, like you're in line at the bank. Once you're in that position, have somebody with their camera stand about 8 feet from you, hold the camera vertical, and take a picture of you that includes your feet all the way up to slightly over your head. Once they take that picture, have them take a few, but once we take that picture, what you want to assess for is, starting from the bottom up, you want to look and see, first of all, does the pelvis look even? If you have a belt on, the belt will give you a good indication. Basically, that belt line should look nice and level. If one side's tipped up, if it looks like you're kicking out to one side, that's an indication that you may have a leg length difference. Another thing you want to look for is when you're standing, does one arm look like it's swayed out to the side? So for instance, if you are tipping to one side, you'll see one arm kind of tighten up to the body, and one arm have a big gap underneath it. Again, that's another indication of a possible leg length difference. The third thing you can look for is, do the shoulders look even? Are they straight across, or is one shoulder sitting high, one shoulder sitting low? And the fourth thing you can look for, and I find this is one of the most obvious tells, is when you look at the whole picture, the line, when it comes over top of your head, does it come right off the middle of your head, or is your head sitting off to one side or the other? That's often a very good tell that your leg length difference may be different. And the reason for that is your body has reflexes that actually try to correct for imbalances. So even if there is an alignment issue down here, your head won't tip off like the Leaning Tower of Pizza. It'll actually start to bend back. The body will bend it back to try and keep it even. This is the reason why people can have leg length differences that go on for months or years and never really have too many problems with it until all of a sudden it gets to be a major issue. The body just can't adapt anymore. But that's one of the things that you can look for. There's these and many other things, but if you think that a leg length issue is possibly something that you may have going on, the best thing you can do is contact our office, contact a chiropractor in your local area if you do want, but we can get you in contact with somebody who can help do a full assessment on you and determine if this is what's going on. You now know that a leg length difference isn't just a small detail. It can be the underlying cause of ongoing back, hip, or leg pain that never seems to go away. And you also now have a simple at-home test that you can use to check whether short leg may be part of your problem. It's a small step that can make a big difference in understanding what your body's been trying to tell you. If your test suggests a possible imbalance, or if you've ever been told you have a short leg but were never given a proper assessment or foot lift, look for a chiropractor or therapist who understands structural alignment and can perform a detailed leg length and pelvic evaluation. That's the next step towards long-term relief and better body balance. If you found value in this video, give it a like and share it with someone who's been struggling with chronic pain. And if you have any questions, drop them in the comments below. I read every one. Be sure to subscribe if you want real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms so you know exactly what to do next. I'll see you in the next video.